Good afternoon, everyone. I call this hearing to order. A quorum is present, and without objection, the chair is authorized to declare a recess at any time. I want to welcome all members and witnesses to today's Oversight and Investigation Subcommittee hearing, Modernizing the VA Police Force, Ensuring Accountability. I want to remind all participants of some of the items to facilitate today's virtual hearing. If you're experiencing connectivity issues, make sure you or your staff contact our designated technical support so those issues can be resolved as quickly as possible. In addition, members and participants today can have robust engagement, and to encourage that, we ask that members continue to remain visible on camera for the duration of their participation unless they experience connectivity issue or other technical problems. When you're recognized, you'll need to unmute your microphone and pause for just a couple of seconds, 2 or 3 seconds before speaking, so that your words are completely captured on the live stream. And if you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteransaffairs.hearings@mail.house.gov. It will be uploaded to the committee document repository. Any questions from anyone before we proceed? Well, hearing no issues, we will then move on. I will now recognize myself for an opening statement. The VA Police have a vital mission within the Department of Veterans Affairs. They protect VA facilities, ensure the safety of our nurses, doctors, and employees, as well as the veterans' families and public that they serve. The responsibilities of VA Police are above and beyond those of most police forces across the country because VA Police operate in a healthcare setting and must serve the needs and experiences of the veterans community. A VA police officer is often the first person that a veteran will see when arriving at a VA facility and the last person they will see when they leave. It's a key role for ensuring that VA is a welcoming place for all. And for those veterans in crisis while at a VA facility, police officers may be the first to respond and to offer help. With such an important role day in and day out, we should all agree that VA's police must be effective, accountable, and well managed. That's why the subcommittee included language in the Veterans Compact Act that requires VA police to be trained in crisis intervention and de-escalation to help prevent veteran suicide. The Compact Act became law early this year, and we'll hear about the implementation of this vital training. 2 years ago, the subcommittee examined the state of VA police and its operational management deficiencies. The Office of Inspector General and Government Accountability Office had reported serious problems that affected basic accountability, including antiquated record-keeping systems, inadequate oversight, and confusing lines of authority. For example, police at all VA facilities still relied on a temporary system for processing arrest, use of force, and other records. We're here again today to discuss VA's progress and challenges in these same areas. And some of these problems go back decades. In March of 1988, the Office of Special Counsel found that the VA police force was struggling without clear lines of authority and that VA needed to establish a central office to oversee VA police. Fast forward more than 30 years and VA is still struggling with instituting effective reforms. The VA Inspector General came to the same conclusions just 2 years ago, and those recommendations largely remain unimplemented. Based on my conversations with VA leaders and today's testimony, I know the department recognizes that we must continue reforming and modernizing VA police. However, VA still has a confusing leadership structure, causing many to wonder who's in charge. So today we have 4 representatives from various VA offices to discuss the recent progress that's been made in its police modernization. Just the fact that we have 4 VA witnesses testifying shows the problem here: overlapping jurisdictions, complex hierarchies, and fragmented oversight. Clearly, VA is still struggling to establish central leadership decades after this problem was first flagged. Today, I hope to hear why VA's most recent organizational realignment is the answer and does not repeat the same mistakes from the past. In addition to that, governance, beyond the governance and leadership issues, VA has also continued to struggle with recruiting and retaining quality police officers. I understand that uncompetitive pay and benefits have led to high turnover and has hampered VA medical centers' ability to hire and keep officers. So I'm optimistic about the implementation of new special pay levels and a more transparent career ladder for police but VA medical center directors have wide discretion to implement these special pay rates, which has led to huge differences between facilities. So I'd like to hear from VA how it plans to refine and implement its recruitment and retention strategies to achieve greater fairness and equity across the enterprise. There needs to be a permanent fix to this issue, not just temporary fixes. Special pay rates are an immediate solution to the problem, but don't count toward officer retirement benefits. So we need to fix that and ensure that VA police have the same retirement benefits as other federal law enforcement officers. To address many of these problems facing VA police, Representatives Rice and Radowagon sponsored a bill that would require more progress in areas like transparency, body-worn cameras, and record keeping. The bill passed the House, and we're working with the Senate for it to become law. However, VA can and should take many of these steps sooner rather than later and not wait on legislation. So I look forward to hearing from all of our witnesses today about what progress has been made in recent years and the timetable for addressing some of these ongoing challenges. I would now like to turn things over to General Bergman for 5 minutes for an opening statement.
Thank you, Mr. Chairman. First of all, if everybody can hear me, give me a thumbs up. Okay, good. First rule of military communications, make sure you got on the right frequency. Good to see all your smiling faces. Thank you, Mr. Chairman. And again, thank you to our witnesses for being here today to discuss VA's police force modernization. The VA police force is responsible for protecting some 9 million veteran patients and roughly 400,000 VA staff at over 140 medical centers around the country. Unlike other federal law enforcement officials, VA police officers must complete their mission in the ever-demanding world of VA healthcare. That means police officers are expected to be both law enforcement officers and at times quasi-social workers helping vulnerable veterans navigate complex security and healthcare situations. It's a difficult job, to say the least. So to our VA police officers, I say thank you. Thank you very much. An organization of this size with this large a responsibility must be continuously evolving, and leaders must always strive for improvement. In October 2019, VA announced a plan to modernize the police force. The effort intends to map out police officer career paths, make changes to the chain of command, establish facility staffing standards, and evaluate pay and retirement benefits. The ultimate goals of these changes are to improve recruitment, retention, and police force operations. These are good people, and I support the efforts of the department, but progress has been slow, and I do have concerns. During staff conversations, our witnesses have informed the subcommittee that they intended to deploy body-worn cameras nationwide. However, in testimony during a legislative hearing on a bill that would require body-worn cameras, VA balked at the cost, process, and timeline to deploy these cameras. There is certainly a cost, but body-worn cameras serve as a means of accountability and protection for veterans and VA police officers. VA must prioritize this effort, establish the necessary policies, and deploy these cameras as quickly as possible. I also have concerns that VA police officer pay and retirement benefits need to still be looked at. As of May 2019, VA police officers were on average paid about 22% less than their peers in local law enforcement. To address this issue, VA authorized special salary rates, which allows VA medical center directors to supplement the pay of entire police force at their facilities. 119 medical centers, or 82% of the police force, have executed special salary rates. I applaud VA for taking this step to retain its police officers, but with 82% of the entire force receiving special salary rates, I am concerned with the sustainability of supplemental pay and how VA will properly budget for the cost of police officers in the coming years. I understand that VA is evaluating modifications to both police officer pay and retirement benefits, but that no clear decisions have yet been made. VA must take steps to protect the investment taxpayers have made to train these officers, many of whom are veterans, and I hope to hear more today about the actions VA is taking to decrease turnover. Lastly, but most importantly, VA police officers are still saddled with a complicated chain of command. I believe this is an Achilles heel for the force. The Office of Human Resources Administration, Operations, Security, and Preparedness writes policy and is responsible for conducting training, credentialing, and oversight of the police program. However, the Veterans Health Administration is responsible for workforce management and day-to-day operations at the facilities. Badged officers do not report to HRA OSP, rather they report to the medical center's chief of police, who reports to the facility director, who reports to the VISN director and chief of police, who reports to the assistant undersecretary for health for operations, who reports to the undersecretary for health, who reports to the deputy secretary, who reports to the secretary, who finally reports to the president. That's a mouthful. As I said 2 years ago during our first oversight hearing on VA police, this is bureaucracy 101, disparate governing officer causing confusion regarding program roles and officer responsibilities. As the modernization efforts continue, I want to see the roles and responsibilities of each office clearly defined so that police officers from a recruit to a senior chief of police can clearly identify and navigate these chains of command. While progress is being made on the topics I have just raised, it is clear that the department is still working on the same issues we were discussing a couple of years ago. I'm concerned that, like many of the decisions on the effort coming out of the Biden administration, there is a lot of talk but little action. Unfortunately, we saw more of this due to lack of action in the late delivery of VA's written statement to the committee, which arrived less than 20 hours before today's hearing. I would expect that this does not become a pattern, as such inactions are a disservice to the members of this committee and the veterans they represent, and unnecessarily inhibits our ability to conduct oversight. Again, I thank our witnesses for being here today, and I look forward to a constructive and productive conversation. With that, Mr. Chairman, my apologies for taking an extra minute, but I yield back.
Well, thank you, General Bergman, for your comments. I agree with your sentiments. Would also note that I was disturbed with the late submission of the testimony that gave staff and members precious few hours to review it before today's hearing. We would hope that in the future it would be submitted in a much timelier fashion. With that, I want to recognize our witnesses for their opening statements. First up, we have from VA, Mr. Louis Ratchford, Chief Security Officer at the Office of Human Resources and Administration. He's accompanied by Mr. James Ward, Executive Director of the Law Enforcement Training Center and Chief of Police at the Office of Human Resources and Administration, Operations, Security, and Preparedness. Ms. Tammy Zarnecki, Deputy Assistant Undersecretary for Health for Operations at the Veterans Health Administration, and Mr. Troy Brown, Senior Security Officer at the Veterans Health Administration. Mr. Ratchford, I'll turn it over to you for 5 minutes.
Good afternoon, Chairman Pappas, Ranking Member Mann, and members of the subcommittee. Thank you for the opportunity to discuss the governance and accountability of VA police and our collective efforts to strengthen the law enforcement portfolio at the Department of Veterans Affairs. I am accompanied today by Mr. James Ward, Executive Director, Office of the Chief of Police, and my colleagues from the Veterans Health Administration, Ms. Tammy Zarnecki, Deputy Assistant Undersecretary for Operations, and Mr. Troy Brown, Senior Security Officer. VA police officers are federal law enforcement officers who serve a critical role in securing facilities and protecting patients, visitors, employees, and VA property. Since the release of a VA Office of Inspector General report and adequate governance of VA police program at medical facilities, VA has clarified roles and responsibilities between OSP and VHA with respect to VA police. VA established a police governance council co-chaired by OSP and VHA with representatives from across the department. Moreover, the department created a new office in OSP to assist with strategy, policy, and oversight of police matters. And VHA hired a permanent senior security officer at headquarters in each of the 18 veteran integrated service networks across the country. Ensuring physical security at VA facilities requires VA police officers to balance safety and security concerns with providing an open and welcoming healthcare environment for our nation's veterans. How VA police officers handle law enforcement and safety issues is a critical component of the customer service culture instilled at each individual facility. To assure security on VA property, VA has entered into an agreement with the Department of Homeland Security to use the modified infrastructure survey tool as a risk assessment data tool for use during security and risk assessment operations. MIST will be implemented incrementally to all facilities under the department's purview. VA has made significant progress for report exec to ensure use of force information is recorded completely and accurately. Since transferring the report exec platform to the cloud, the program is now operating fully within its intended use, and very few issues have developed. VA continues to improve use of force incident tracking and analysis. We are also improving processes to ensure its transparency between VHA and OSP for law enforcement related incidents. To ensure medical facilities can determine the appropriate number and composition of police officers, VA is refining a staffing model, decision tool, and policy directive. Facilities across the country will be able to use these resources to tailor staffing levels based on requirements and facility footprint. The policy sets minimal staffing standards as determined by the staffing decision-making tool and provides flexibility to medical center directors to assess risk and make appropriate hiring decisions. VA Police serves on the front line at our medical centers to provide support to veterans in crisis. Currently, VA provides much of the training required in Section 205 of the Compact Act at the LETC. During the 400-hour VA post course, VA police officers receive 56.6 hours of training devoted to behavioral science. VA police officers must also complete monthly training, including suicide prevention, suicide by cop, and crisis intervention training as part of their overall training requirements. Over the past 2 years, there have been over 100 confirmed saves of veterans in crisis who had an interaction with a community first responder. VA looks forward to this opportunity to further enhance efforts to strengthen the VA police program. Our objective is to give our nation's veterans the top quality care they have earned and deserve while keeping them safe. Chairman Pappas, we appreciate this subcommittee's continued support and encouragement in identifying and resolving challenges as we find new ways to care for veterans. This concludes my testimony. My colleagues and I are prepared to respond to any questions you may have.
Well, thank you, Mr. Ratchford. And I should have mentioned at the top as well that Ranking Member Mann of this subcommittee unfortunately couldn't be with us today. So we have General Jack Bergman, who is a very able substitute and someone who's very familiar with the workings of this subcommittee joining us today, and we're very pleased by that. After that, we will now turn things to Ms. Seawright, Ms. Leanne Seawright, who's the Deputy Assistant Inspector General for Audits and Evaluations at the Department of Veterans Affairs Office of Inspector General. I'll recognize you for 5 minutes.
Chairman Pappas, General Bergman, and subcommittee members, thank you for the opportunity to discuss the OIG's oversight of VA security and law enforcement program. The OIG is committed to serving veterans and the public by conducting oversight of VA programs and operations through independent audits, inspections, reviews, and investigations. That oversight is particularly critical when the safety of veterans and their families, VA personnel, and visitors at VA facilities are concerned. How VA police provide these protective and law enforcement services, particularly how they are guided, managed, and supported, certainly warrants attention. Our prior oversight of VA's police program identified governance and information management systems challenges. In December 2018, we reported VA did not have adequate and coordinated governance over its police program to ensure effective management and oversight of program requirements for its police workforce nationwide. In June 2020, we reported that the VA's police electronic records management system and how VA did not have an effective overall strategy or plan of action to update its police information system. The report concluded that VA's police electronic records management systems did not provide VA program leaders or the workforce with comprehensive police program information to do their jobs. The common challenges identified in both OIG reports relate to the splintering of governance responsibilities, confusion about roles, and a lack of clear guidance, which undermine VA's well-intentioned goals and objectives. The December 2018 report found that the governance problems occurred and persisted in part because of confusion about police program roles and authority between VHA and OSLE. The Deputy Undersecretary for Health for Operations and Management at the time of the audit told the OIG team that OSLE was responsible for centrally managing police program activities at VHA facilities. However, OSLE did not in fact have that responsibility or the authority needed to manage the program operations. Governance challenges also stemmed from lack of centralized management structure or the clear designation of staff within VHA to direct and oversee the police program. The OIG revealed 4 key areas with deficiencies: systemic tracking and assessment of police program operations and performance, facility appropriate police officer staffing models and officer shortages, timeliness of inspections of police operations, and guidance on how VA police officers investigate alleged misconduct of facility leaders who manage the police program or control its resources. The OIG made 5 recommendations to the VA's Deputy Secretary that focused on areas of governance, staffing, the inspection program, and processes. All 5 recommendations remain open based on VA's most recent update received on May 4th, 2021. Their next update is due to the OIG on July 29th, 2021. The OIG recognized that a significant factor in effective police program governance is access to accurate and timely information. Such information can help identify security and safety risks, determine the proper allocation of resources, and measure progress in achieving police program goals. Our June 2020 report found that VA did not have an effective strategy to update its police information system. Persistent weaknesses included inadequate planning, limited officers' access to information, and incompatible parallel systems. The OIG made 7 recommendations to the Assistant Secretary for HRNA OSP and the Assistant Secretary for Information and Technology. Based on the most recent update from VA received on April 20th, 2021, VA has taken sufficient actions to close 2 of the 7 recommendations, recommendations 5 and 7. Their next update is due to the OIG on July 19th, 2021. In conclusion, an effective governance structure is critically important to the functioning of any program, but imperative where there are issues of public and patient safety. The confusion about program roles and authority has made it difficult for VA to have any degree of certainty that its police personnel and resources are being effectively deployed. Until proven actions are taken to address the OIG oversight recommendations, the safety of veterans and their families, VA personnel, and visitors to VA facilities will be affected. Mr. Chairman, this concludes my statement. I would be happy to answer any questions you or the other members of the subcommittee may have.
Well, thank you for those comments, Ms. Seawright. Our next witness is Ms. Katina Latham, Acting Director of the Physical Infrastructure Team at the Government Accountability Office. Ms. Latham, thank you for joining us, and you're recognized for 5 minutes.
Thank you. Good afternoon, Chairman Pappas and ranking members and members of the other members of the subcommittee. Thank you for the opportunity to discuss Department of Veterans Affairs management and oversight of security and VA police at its medical centers. The Veterans Health Administration provides critical services, as we've mentioned, to veterans at its medical centers. And the VA is expected to provide a safe environment at each of these centers, not only for the patients, but also for staff and visitors. My testimony today will focus on 2 findings from GAO's report and will include updates on VA's progress towards addressing the recommendations we made. I will focus on VA's efforts to ensure physical security of VA medical centers and improve the completeness and accuracy of the data on use of force incidents at these medical centers. First, in 2018, we found that VA's risk management policy did not fully reflect federal standards. These standards set the process that agencies should follow and use to identify and address security risks and appropriate countermeasures, and then ensure their effectiveness. We also reported that while VA engaged in some limited oversight of medical centers' risk management activities, it lacked an oversight strategy across the medical centers. So in absence of such strategy, we found that individual medical center sites had established their own policies to carrying out VA's risk management policy. We recommended that VA revise its risk management policies to incorporate these federal standards and develop an wide system strategy of oversight. VA has taken actions to address these recommendations, but has yet to fully implement them. Last month, VA officials provided us a draft of its risk management policy and informed us of their plan to use the survey tool that my VA colleagues mentioned. And this tool they'll use to help oversee the effectiveness of its system-wide risk management program. VA officials noted that they expect the revised policy and assessment tool will be fully implemented in fiscal year 2022. In addition to overseeing and addressing security risks at its medical facilities, it is also critical that VA improves oversight of its medical center police units to better assess the impact of its use of force policies. We reported in 2020 on the use of force data in VA's central database. This is where, as they've mentioned, police officers record their daily activities. We found 3 data issues which collectively limited oversight. First, incomplete characterizing of the type of force used. Second, inaccurate data on the highest level of force used. And third, the potential for duplicate data entries. VA has taken some steps to address our recommendations to improve the completeness and accuracy of its data. VA officials reported they are entering the use of force information into an interim data sharing site while they work to secure a new database. This site includes a dashboard with information, for example, on use of force incidents and whether the officer involved was investigated and whether there was an administrative or adverse action taken against the officer. In closing, while VA has made progress in addressing GAO's recommendations for both of our reports, continued attention by the VA is needed to ensure they are fully addressed. Until VA implements a risk management policy that adheres to federal standards and establishes a system-wide oversight process, the physical security of its medical facilities may be at risk. And while the VA has improved its data collection to support the management and oversight of use of force incidents among its police officers, a database is needed to better track and analyze investigations of these incidents. We will continue to monitor VA's progress on our recommendations. Chairman and members of the subcommittee, this concludes my statement. I am happy to answer any questions you have.
Well, thank you very much for your testimony, Ms. Latham. We will now turn to the question portion of today's hearing, and I'll begin by recognizing myself for 5 minutes of questions. I'd like to turn first to our VA witnesses. And this is a large panel. Our witnesses from VA include a Deputy Assistant Undersecretary, the Chief of Police, the Chief Security Officer, and the Senior Security Officer. There are other VA offices involved in this equation, including each of the 139 medical center directors and facility chiefs of police who have roles in managing the VA police force. So my first question for our VA witnesses is just meant to be a simple one. Who's in charge of VA police? Oh, Mr. Ratchford, you need to unmute.
You would think by now I would have that under control. Thank you for the question, Chairman Pappas. Within the Department of Veterans Affairs, there's 2 distinct functions. There's a policy and oversight function, and then there's an operational function. The function for policy oversight, which drives governance for the department, rests with the Office of Human Resources Administration, Operations Security and Preparedness, which I represent the Operations Security and Preparedness portion of that equation. The operational piece is managed by Ms. Tammy Zarnecki, my colleague from VHA, which represents serves as the Assistant Deputy Undersecretary for Operations.
So I appreciate the response, and it's a complex response to a really simple question. And I want to give you an example of why this is a concern. So each of the VA witnesses has been involved in developing a tool that medical centers will use to ensure they each have adequate numbers of police officers. The staffing model still hasn't been finalized, and I'm not sure who will enforce the staffing requirements or how. So maybe, Ms. Zarnecki, if I could turn to you and just ask if the staffing model is a set of guidelines or requirements for medical center directors to follow, and who's going to ensure that it's properly enforced. I think the key thing here is clear lines of responsibility, accountability, and being able to improve governance structure moving forward. I'm just wondering on this one particular issue, what that will look like and how VA is going to enforce this.
So thank you for the question. We will issue the staffing policy out to the medical centers with the decision tool. The decision tool will help guide what they need locally. And so there's inputs into that decision-making tool. Workforce management and consulting will do an annual review to make sure that the staffing policy has been implemented. And through the operational chain, we'll make sure that implementation is part of that review with the network director as well as the facility director.
Okay, and maybe I could get Ms. Seawright's take on this. You referenced this in your opening testimony. OIG found in 2018 that VA police didn't tailor its levels of staffing to the needs of various kinds of facilities. I'm just wondering if you could comment further on VA's staffing model, whether this is a good solution, and what challenges are ahead for implementation of this.
So the staffing model in theory is a good solution moving ahead. However, one of the challenges that the facilities face is the funding at each facility and how that facility director chooses to apply that funding to their workforce. So while a staffing model could say that a facility needs 27 people, it's really up to the director and whether they're going to apply the resources to pay for those 27 people.
Well, I think that's an important point. And maybe I could put it back to you, Ms. Zarnecki, if you can comment on that one issue. That's obviously a concern. In order to ensure that this is implemented, we're going to have the dollars and cents to be able to hire these folks and attract and retain them. So can you respond to that concern?
I can try to respond to the concern. We have staffing models in various programs in our organization. Our chief of police is a service line chief at the medical center who submits a budget request through his medical center director. So the tool is there to direct and guide on what appropriate staffing levels are. And workforce management will assure that the staffing level is being addressed. And then from an operational standpoint, it's the responsibility of the organization to make sure that there is sufficient budget allocated to the medical center through the VISN.
I appreciate that. Maybe I could just get Ms. Latham's comments from GAO's perspective on this issue of the staffing model. I know that GAO has expressed concerns about VA not considering all the relevant factors when determining a facility's security level. So I'm wondering, your take on this VA staffing model as it moves forward, and what things you'll be looking for.
Thank you for the question. As I noted, VA has certainly revised its risk management policy, and it's following federal standards as it's written. And it's to consider all relevant factors, including a facility's security level. And we did not specifically review the staffing model or inputs as part of our work. This is an area, as we're discussing, that VA may want to think about as they move towards implementing its revised policy. So we certainly do think that that would be important to inform those decisions. And then it will help to improve the quality if they would move forward when they move forward with implementing the tool that we mentioned, because that tool follows the federal standards. And that tool will help them to make sure that they have all the requirements in place, and whatever decisions are informed related to the staffing model and whatever facility security levels should be in place based on those staffing models, that tool would be the right place to go.
Well, thank you for your thoughts there. And I'm glad we could kind of bring everyone in on this issue. I think we'll talk a little bit more about this. I apologize for going over on our time. With that, I'll turn things over to Ranking Member Bergman for 5 minutes.
Yeah, thanks, Mr. Chairman. Mr. Ratchford and Ms. Zarnecki, how many violent crimes such as active shooter, aggravated assaults, robberies, sexual assaults were committed on VA property last fiscal year?
Thank you for that question, Ranking Member Bergman. The VA police uses Report Exec to track those type of incidents, and I will have to take that for the record in regards to the exact number of incidents by category, as you stated, to report back to the committee on.
Okay, well, bottom line is, according to the documents provided by VA, the answer is 5,002 violent crimes, which is nearly 2,000 more violent crimes than those that occurred on VA property in FY 2018. I mean, would you agree that a 59% increase is unacceptable?
I will agree that.
That could be just a yes or no answer.
Yes.
Both Mr. Ratchford and Ms. Zarnecki.
Yes.
Yes.
Yeah, 59, almost 60%, almost two thirds increase when we're putting together plans to to do this. Well, I guess the point is, since you're working it, we've got the numbers, VA has the numbers. What are you all, and I say you all because we got the multiple departments within the VA here, what are you and the Biden administration doing this to basically not only stem, but stop the rise of violent crime and protect our veterans and our VA staff aboard your campuses?
I will start with the answer to that question. We're using, as we've improved Report Exec, we're using the information we're harnessing from across the entire enterprise to better understand the activities going on by location, by region, and as an enterprise, to come up with police curbing activities we can do to help reduce crime across the enterprise. We're involved in this at the enterprise level, within OSP, and that instrument is managed by our Law Enforcement Training Center, which we believe is the right place to have it and address the issues and give us the right analysis. I will now hand it over to Ms. Zarnecki with VHA to talk about some of the things they may be doing locally within VHA to assess the same problem.
Hi, thank you. Ranking Member Bergman, I am actually going to ask our Senior Security Officer, Troy Brown, to answer that question.
Thank you, Mr. Bergman. Right now, the VA police do have senior security officers within each visit. Those visit security officers are out assessing the police departments, conducting physical security surveys of those apartments, analysis of those departments, reviewing the camera systems to ensure that the uniques of the camera systems are clear and that the systems are working appropriately. We're also working with the Law Enforcement Training Center regarding modernization and strengthening the training aspects of the police department so that we can better improve the security and safety and security of the facilities we protect.
Yeah, thanks, Mr. Brown. I know my time is fleeting here, but I guess, let's do the math and why I'm still concerned here. The concerns are justified by the fact that we have 4 VA witnesses from 2 different offices here today to discuss the same topic. Also concerning is that the VA has yet to close a 2018 OIG recommendation to clarify program responsibility between VHA and HRA OSP. How will the police modernization, since you're working on police modernization, address this governance issue, this chain of command, this structure issue? Because you can modernize anything you want. We could get all the body cameras we want, but if we don't actually modernize the, if you will, the security structure we will have accomplished nothing. Anybody want to take that one, Mr. Ratchford?
Yes, sir, I will take that one. One of the elements of modernization that we're doing within the department is we've established a governance council. What this governance council is not only representative of OSP and VHA, but it also is comprised of other elements of the department to address these challenges from an enterprise perspective, because the VA property footprint is much larger than just the medical centers. We're taking an enterprise approach.
Yeah, I hate to cut you short, but my time has expired. But the bottom line is, police officers and people in the military who win the fight don't have the luxury of doing the bureaucratic answer to everything. So with that, Mr. Chairman, I yield back.
Thank you, General Bergman. I'll now recognize Representative Luria for 5 minutes.
Well, thank you, Chairman Pappas and Ranking Member Bergman, and for our witnesses today. So I just wanted to touch on law enforcement officers because they put their lives on the line every day to protect us, whether they're on the street or at a VA medical center or at the Capitol. They risk their lives to protect ours. However, all law enforcement officers are not treated the same. And that was particularly brought to my attention about VA police officers, because they're among the 30,000 federal officers that are not covered by the same retirement rules that apply to most federal law enforcement officers. VA police are not considered federal law enforcement under the retirement rules, and as a result, do not receive the full retirement benefits that other federal law enforcement retirees do receive. And I believe that VA police officers should earn these benefits due to the rigors of their jobs. We just cited the number of violent and other crimes that have happened at VA facilities and on VA property over the last year. I'm a co-sponsor of Bill HR 962, the Law Enforcement Officers Equity Act, that would correct this inequity for VA law enforcement officers and across the federal government. But really pertaining to what we're talking about today, and we've talked about retention, Mr. Ratchford, would you say that potentially this lack of full law enforcement retirement benefits is contributing to a low retention rate amongst the officers?
Thank you for that question. I believe there are multiple issues associated with our retention program within the VA police. However, the Veterans Health Administration is working very hard from a workforce management perspective to increase incentives for law enforcement officers across the enterprise. I would also like to pass this one off to Mr. Troy Brown. They can elaborate on some of the positive things that are being done to retain law enforcement officers in the VA.
Okay, but either one of you, could you, comment just on that one issue? Would you find it likely that a law enforcement officer who could do similarly the same work for the federal government could work within a different federal agency and receive significantly better benefits, that would contribute to losing those officers to different agencies?
Take that question, Ms. Laura. The answer to your question directly is yes. I'd like to talk about a few things that we've done in combination in order to try to improve those aspects of the job. I'd like to say, first of all, I am one of those GS5 police officers that started at the VA 24 years ago. So I certainly understand where the police officers are and the benefits that they seek after. And I certainly take your question seriously. What we understand from looking at some of the issues with VA police, we know that SSR, special salary rates, is not the best way, but it was the quickest way based on our current situation when we looked at establishing special salary rates. And to Mr. Pappa's point, it does not contribute to the retirement of the police officers. But when, as we looked at the entire project and establishing career ladder PDs for the police from a 5 to a 14, as well as including the relocation, recruitment, retention, and relocation benefits in combination, it improved the workforce retention. And we were able to draw in police officers at a greater speed. We do look forward to the future and looking at other flexibilities in order to work towards retirement for the police officers for the 6C retirement. It requires a legislation change, but it is certainly something VHA, HRNA, and OSP plan to attack. But we wanted to look at the quickest way to address some of the pitfalls that we were experiencing in 2018. And I think we've had some success with that.
Okay, well, thank you. And I did, want to get out of your question if you would support legislation that would help fix this inequity. So I did take away from that, that could be a next step that could potentially help with retention. And I, as noted earlier, and really applaud the effort to train the VA police officers with mitigation practices, social work practices, best practices, especially in challenging situations, including suicide prevention. And, would just note that you are going to great lengths to provide that valuable training. It is having an effect on, stopping these instances in VA facilities. And it truly is a shame that those officers would not be incentivized to stay with that special training that they've received through the, intake process in the Law Enforcement Training Center. So I know my time has expired and I will get back.
Thank you very much, Representative Floria. I'll now turn things over to Representative Radewagen for 5 minutes.
Thank you, Chairman Pappas and Ranking Member General Bergman for holding this hearing. Thank you to the panel for your testimony. Mr. Ratchford, I'm the lead GOP co-sponsor on HR 2429, which would require VA police to make certain changes, including mandating nationwide use of body-worn cameras. Now, VA balked at this requirement in testimony earlier this year, but had previously indicated that would be a national requirement. Please tell me where VA is in developing this policy. And do you intend to make this a nationwide policy? And if so, how long do you believe it would take to implement? And finally, will this policy go through the regulations process so members of the public can comment on its contents?
Thank you for that question. Currently, VA is working on, we have a draft policy for body-worn cameras, and we are also working in conjunction with the Veterans Health Administration to conduct multiple pilots to identify the feasibility of implementing and the requirements associated with implementing body-worn cameras across our campuses. We have conducted market research with vendors that provide this service, and we're looking at ways to resource body-worn cameras. As the VA believes, body-worn cameras is something that is essential to accountability for VA police. The current policy we are working is working right now as a VA policy within the department, and once that policy is complete, it will be shared with the entire department and with all other entities that would like to see the policy so that they can understand how VA is implementing body-worn cameras within the Department of Veterans Affairs.
Ms. Sarnecki or Mr. Ratchford, though the policy is not finalized, can you share how the department will handle footage of incidents captured by body-worn cameras? For example, how might a veteran or a member of the public obtain footage taken of them during an incident with VA police? And Ms. Sarnecki, in carrying out the body-worn camera pilot programs, what lessons do you think VA learned about camera use in medical centers, and how will you apply those lessons learned in the final policy?
Thank you for that question. I will start, and then I'm going to ask Mr. Troy Brown to chime in since he actually conducted the pilots. But we anticipate that data will be stored. We will have a server that will store that data. It'll be a secured server. That footage will have to protect privacy of bystanders and other folks that are in the medical center. So we have just had discussions with our privacy office. I'm going to actually ask Mr. Brown to go over some of what the pilot has shown.
Yes, ma'am. Thank you. Ma'am, what the pilot has shown is that the body-worn camera devices does create better transparency, greater accountability. We're able to view both perspectives from the police officer and the subject that they are involved in or the incident they're involved in. We have live coverage that can feed to our Integrated Operations Center for serious incidents. We work directly with the Law Enforcement Training Center to evaluate the use of force incidents more efficiently because we do now have the video that could help assist us in looking at ways to make better improvements in our training. when we determine that training is deficient in that area, or if we just need to improve the training for the use of the body cams. The 2 pilots we conducted recently concluded at the end of August, and we're prepared to move forward once the leadership makes decisions about the HR 2429 bill.
Thank you, Mr. Chairman. I yield back the balance of my time.
Well, thank you, Ms. Radewagen. I'll now recognize Mr. Sablon for 5 minutes.
Yeah, thank you. Thank you very much, Mr. Chairman, for having this hearing. I come from a district, as many of you know, where I have no need for security officers at this time. We have here we just hired on board a social worker, and we have an outreach, a out-care patient, a clinic fee-based, and the VA has a clerk on staff here who acts as if she was the regional director. So it's far from getting but I'd like to continue on with or associate myself with Ms. Ruria's questions and ask, I'm not sure who would have the answer for this, maybe Mr. Brown. What is the average tenure for VA officers across the country, and what is the department doing to improve officer retention? Please.
Sir, can you repeat the first part of your question?
Yeah, what is the average tenure for VA officers just across the country?
The average what, sir? I'm missing that.
Tenure. T-E-N-U-R-E. Yeah, sorry, English is my third language, so.
I apologize.
Tenure.
We actually conducted a recruitment study about 2 years ago, and we created a national strategic recruitment plan. The average tenure of a police officer is 10 to 12 years.
Thank you. And so maybe from that study, or maybe just from based on retention data you have, I hope you have been tracking, what effect does those efforts had on retention and tenure?
So as a result of the national strategic recruitment strategies, we're currently evaluating the results of decisions made with the special salary surveys, the career ladder PDs, the recruitment, the retention, and relocation benefits. In a combination, we pulled those 3 together in the last 2 years to improve pay for the police officers. So to Mr. Papa's point from earlier, we do have the SSRs and it does improve pay, but the career ladder PDs and the flexibilities to grow from within are certainly improvements combined with the special salary surveys. Adding on to those features are the relocation, recruitment, and retention incentives. After the evaluation period, we'll look at this national strategic recruitment plan and make better improvements and refinements in order to continue to improve. As I spoke to Ms. Laurie a little earlier, we are looking at legislation changes to look at the flexibilities for the VA to pay officers at a salary that contributes to their retirement, which is the 6C program that we're interested in.
Okay, maybe it's just me, but the Chairman Papas asked a question if there was a clear line of, clear line of who is responsible for doing who or what within the, I don't know if an answer was provided, I just didn't, or maybe I did. You did and I didn't get it. So would someone, again, just a short one, please answer if there's clear line of, org structure, like who is and responsible for doing what, for example. Thank you. That's my last question.
Thank you for that question. And as a correction to the record, ultimately the person responsible for VA police is the Secretary of the Department of Veterans Affairs by law.
Okay.
For policy and oversight and governance of the Secretary's authorities, that lies with the Assistant Secretary for the Office of Human Resources, Administration, Operations, Security, Preparedness. The operational responsibility of that mission established by VA policy belongs to the Veterans Health Administration.
Okay, and the reason I asked that was because on January 6th, people who are supposed to be trained for security had questions, so, you know, who's supposed to be doing what. So I'm not saying that's going to happen again. I hope God, I pray it doesn't, but just there has to be that line based on a recent experience. Chairman, thank you. Thank you, the witnesses, and thank you. I yield back.
Well, thank you, Mr. Sablon. I guess we'll now open it up for a second round of questioning, and I'll begin by recognizing myself for 5 minutes. And I'm wondering if we could get to the issue of veteran suicide. I appreciated the information you provided for VA, Mr. Ratchford, about saves. And I think it's so important that this conversation is always oriented around safety and how we can best be protecting not just the facilities, but the veterans and patients at VA. And so, Mr. Ward, maybe I could ask you this question since you're head of the Law Enforcement Training Center. I know that we've talked a little bit about the Veterans Compact Act that we enacted earlier this year, and it requires that VA develop and implement an annual refresher training for mental health and crisis de-escalation techniques for all VA police at all VA facilities this particular calendar year. And so this is to supplement the initial training that VA police already receive at the training academy when they join VA. A report is due to Congress in January of 2022 detailing the new refresher course curriculum and how many VA police have completed that training. I'm wondering if you can provide some information on how that's going, and if there's any light you can shed on, what you might be presenting to us in just a few months.
Yes, thank you, Chairman Pappas. The Law Enforcement Training Center has a course called Police Officer Standardized Training Course. It's a 400-hour course. Much of what is outlined in the Compact Act, Section 205, the LETC already implies or put that into training methodologies within that course. We also have included a monthly training episode that will cover mental health, suicide awareness, all of those things that are listed in the Compact Act, talk about TBI, those kind of things, and it will be pushed out annually. But where it sits right now is that within the 400-hour police officer standardized training course, all those things are encompassed. In 2009, we partnered with the Veteran Justice Outreach to combat suicide awareness, as well as ensuring that veterans had an alternative to incarceration. We put that training out to all VA police officers from 2009 to 2014. And then we incorporated that training into the police officer standardized training course, which is the 400 hours. We have been training a lot on this subject. In 2009, we'd had industry leading subject matter experts come down to LATC, review our behavioral sciences. And as Mr. Ratchford stated, over 56.6 hours of training in behavior sciences. And they concluded that we had one of the most robust and complete behavior sciences section of any federal, state, or local law enforcement. We were very proud of that. We also, in 2017, partnered with VHA to create a course, Suicide Awareness for First Responders and Outside Law Enforcement. The significance of that course, and Mr. Ratchford spoke briefly about it, was that we partner with a psychologist and police officer, and we go to different locations and provide this training. To date, we've provided over 90 sessions of that training, and we, as Mr. Ratchford pointed out, over 100 saves. But we will continue to monitor the training. We have a mechanism to make sure that all of the VA police officers take the monthly training. That system that we use is called CADIS. It can track, and we'll know exactly when an officer starts and finishes and completes that training. So we will be prepared to provide this committee numbers.
So you don't have any numbers right now on how many VA police officers have gone through that refresher training?
Right now, all police officers that come to the academy receive the training. So every police officer for the past 7 years have received that training that we produce at the Law Enforcement Training Center. We also provided monthly iteration training once a year. And I don't have those numbers. I'd like to take that for record and get those
Okay.
back.
Yeah, if you could get back to us with that information, I think that's helpful. And you referred a little bit to the development of the training curriculum. I'm wondering, you talked about within VHA, who's sort of consulted in putting this together. Are there other organizations that you're consulting as part of this to make sure that it continues to be evidence-based and as relevant as possible?
Absolutely. Outside psychologists and the mental health professions, a lot of PhD people that know a lot more about this topic than I do. We certainly consult with them and make sure that we're training those things that are paramount to what we're dealing with in VA. So we certainly go outside and get that subject matter expert as well.
Well, thank you. I'm over my time and appreciate those comments. I'll now recognize General Bergman for 5 minutes.
Thank you, Mr. Chairman. Dr. Latham, with progress on VA's modernization efforts appears to be stalling, where do you believe the VA should put their next focus first, or first focus next, however you want to put the words together, but prioritize? To put it another way, where is the priority in your mind to give the biggest bang for the taxpayer's dollar being put into this?
Thank you for your question. We've seen, as I noted, progress in VA addressing our recommendations, and we are encouraged by this. In terms of the recommendations remaining, for the recommendations related to physical security, we will be interested to see what the agency does with implementing its revised risk policy and how it plans to use the system that they mentioned, the survey tool, to support the oversight of its risk process. So that would be, for us, the first area of emphasis.
Okay, Ms. Seawright. Oh. Thank you. Sorry, there was a pause. Thank you. Ms. Seawright, same question to you. Where do we get the bang for the buck?
I believe that the largest bang for the buck will be in really defining those governance roles and responsibilities in terms of who is doing what at what level, so that when you do develop your staffing models or as part of those staffing models, that helps influence those workload decisions.
Okay. Ms. Zarnecki, outside of pay and benefits, what other tools or incentives does the department have to try to retain officers?
Sorry about that. I had trouble getting off of mute. Outside of pay, we do have the retention, relocation, and recruitment bonuses that we can use. We also provide education and training. We provide them opportunities to go to LATC for advanced training. We've created a career ladder so that VA police can go from a GS5 to a GS14 in the system. We've created standardized PDs, so police are very clear on their expectations on what they're doing. We provide them opportunities at our leadership development programs to try to help develop their leadership skills so that they can become a chief of police, or so some may want to become a associate director at a medical center at some point in time. So we are trying to use a lot of the tools that we use with our clinical staff as well. Providing them things outside of their job description as an opportunity for them to expand their career.
Okay, again, Ms. Zarnecki, do you need any additional authorities from Congress to help move forward what you just said?
I think the additional authority that would be probably the most beneficial is if we could get the retirement through legislation. I think that our police officers would really appreciate that. They have a really complex job in VHA.
Very good. So I guess what I hear you all saying, all of you, is that you're all in support of getting our police force hired trained, capable, accountable, and doing it in such a way that, number one, they do the job, but number two, there's parity for retention of quality people. So with that, Mr. Chairman, I'm going to yield back. Since I went over a minute last time, I'll try to yield back a minute now.
Thank you, General Bergman. I'll recognize Mr. Sablon for 5 minutes.
Well, thank you very much, Mr. Chairman. Unless you need my time, I don't have any additional questions.
I don't think it's a mistake.
Okay.
Okay.
Thank you, Mr. Sablon. I do have a few additional questions. So, oh, did you have questions, Mr. Sablon? I'm sorry.
No, I yield my time to Chairman Pappas, 5 minutes.
Oh, okay. Well, I'm grateful for that. Thank you. Thank you very much. Ms. Latham, maybe I could ask you a question here. I'm wondering if Report Executive allows VA to look at demographics, including race, as we think about veterans who are subjected to an officer's use of force. Because in the review of 2020, I'm wondering if you saw evidence that VA was looking to see if some groups faced more arrests or were treated with a higher level of force than others. And could you speak to that review and the capability of Report Executive?
Yes, we certainly looked at what data that the VA was collecting in Report Executive, and they did have demographic information, such as race and other things regarding the officer. We did not, though, look further. We did not have any information in terms of the analysis. I think as we mentioned in our report, that was the key piece, is to not only have the data collection piece, but to be able to do the analysis to answer the question that you have asked.
So can you speak to the issue of any analysis that may have been conducted by the department? I mean, I think that's obviously a key component here. And did you find any when you were addressing, when you were taking a look at this particular issue?
Well, the key component for us was, as part of the recommendation, was to be able to have the tool to do that further analyses, which we feel they've made the step, or making the steps to be able to do so, to provide the type of information that you're requesting. We did not specifically look into detail in terms of what analysis they'd be able to provide regarding race and ethnicity.
Yeah. Maybe I could turn this over to VA if you could respond to that issue highlighted there by Ms. Latham. I think that would be helpful for us.
Thank you, Chairman.
Yeah, thank you.
In regards to that question, I will go towards Mr. James Ward to address the issue of the analytical capabilities of Report Executive.
Thank you, sir. Mr. Chairman Pappas, we have made substantial changes to Report Exec. And as it sits right now, you can run reports with data fields such as station numbers, group ID, officer, incident type, and especially those dealing with the use of force component. Specifically, you can nail down your reporting to really draw a higher data analytic so we can make evidence-based decision of what actions our officers are taking out there.
Okay, so you're able to look backwards as well as forwards in terms of the information that you have?
With the Report Exec, it's looking backwards. We can look forward in the fact that we can analyze the data and see where the issues are and make training issues, because sometimes we'll look at reports. All those reports are viewed and they must be sent to the Law Enforcement Training Center within 24 hours of any use of force taken. So we'll look at those reports. We have a team of subject matter experts that review those, and they look for training gaps, trends, things that we need to improve upon. And they also look for best practices, because we do have a well-trained police force that do some wonderful things. So we'll take all of that and make sure that our training is updated so we can make sure that we're pushing out the best possible training for our police officers.
Well, terrific. I appreciate those responses. I think that's a key issue, and I'm pleased to see attention paid there. I don't have any additional questions. I just would like to open it up to any of the members. If they have additional questions, be happy to accommodate them with a few minutes.
Mr. Chairman, I've got one kind of a comment.
Yep. Go ahead, General Bergman, you're recognized.
Okay. Well, very simply, I guess I would, as I look at all of you on the screen here, the question is, and it's kind of a rhetorical question, not to be answered now, but how many more people, veterans and staff members within VA facilities, are we going to put in harm's way because we're evaluating procedures and getting programs into place? I don't see that as an acceptable alternative. So with the VA committee as a whole, not just O&I, is that the next step we have here is a roundtable where we bring in chiefs of police from the different facilities, people who are boots on the ground, dispatchers, whatever it happens to be, because we get a lot of good things done in a roundtable that there can be the, just lay it out without, the concern about what's being recorded on camera. So I think in order to help those veterans at risk and to help those employees at risk, we owe it to all of the veterans and all the people in the VA to get to the bottom of things and get this moving down the road. So with that, I yield back and thank you for everybody's time.
Well, thank you. No, we appreciate your time and participation, General Bergman. I think that's a wonderful idea. We'd love to work with you and the full committee on addressing that and potentially setting up a roundtable soon so that we can, continue our work in this particular area. Seeing no additional comments, I think we'll just bring today's subcommittee hearing to a close. I appreciate the work and commitment and comments from all of our witnesses and members who were part of today's hearing. I think based on the testimony we heard, it's encouraging that there's been some progress in terms of the organization and where VA Police is going. But as General Bergman said, concerns are there, and we've got to make sure we're doing all we can to put the safety of patients, veterans, and staff first and foremost. And I think there are additional steps that need to be taken, and we want to continue to engage in this work as we move ahead. VA leadership is beginning to get everyone on the same page here, and this can't happen quickly enough. And we want to continue to work with you all as you move forward. I think we heard some important comments from GAO and the Inspector General in their testimony today. And I think it came out during the questions as well that there's just more work ahead and plans need to be completed, need to be implemented, and we need certainly much clearer lines of authority and better defined leadership roles. So we'll continue to work on these issues. I really appreciate General Bergman's suggestion of the roundtable, and with the participation of folks who are here today, hopefully we can get that scheduled soon. So thank you all to all of our witnesses for their contributions today. All members will have 5 legislative days to revise and extend any remarks and include extraneous material. So the hearing is now adjourned.